To order the, what are we, the Housing Committee? No, coming
workshop.
home. Heading home, Ramsey. Excuse me, it's been a lot of things going on. Little bit behind schedule, so I'm gonna cut to the chase. And so we sort of eliminated with Deputy County Manager and going straight to Keith. This workshop is sort of to lay out the future, I guess, what we're doing this year in terms of housing stability, what the plan is, and what our legislative agenda is. So, Keith, I'll let you take it away so we could catch up on the timing here.
Thank you, Chair Ortega. Commissioners, County Manager O'Connor, I'm Keith Lattimore. I'm the Director of Housing Stability, here with my team today. We wanted to, as we look back earlier this year, we wanted to come and bring an update to our Ramsey County, Heading Home Ramsey Continuum of Care, to brief the board on kind of where we are as a point in time, so to speak, as to where we are with our legislative priorities, as well as with kind of the layout and kind of revisit where we are as a continuum. To obviously, our team here, I'll let them kind of introduce themselves as they speak. I felt as I would bring a team today, so you won't get tired of hearing my voice. There's actually the talent behind some of the things that we do. So we have some of our team here to be able to update you on various areas of our presentation today. So the workshop purpose today, we wanted to update the board and commissioners on Heading Home Ramsey Continuum of Care. We wanted to bring to you the definition of what is Heading Home Ramsey, the governance and structure, we'll be explaining that, and we'll be looking at the responsibilities, program, and strategic priorities of the COC. We'll look at key performance indicators that's driving our work, and our Heading Home Ramsey and HSD funding. We want to kind of explain those particular pieces. And then obviously we want to follow it up kind of with their 2024 legislative priorities and where we're headed in that area. We wanted to, just talk about the COC. This was designed and introduced by HUD in the mid-90s. Specifically, it was 1994. It was codified in the law by Congress through the HART Act of 2009, and that's our Homeless Emergency Assistance and Rapid Transition to Housing. Just want to make sure we're following slides. Heading Home Ramsey sits within housing stability here in Ramsey County. And if you look at our planning slide, the slide that we're on, we look at our planning and we look at our service delivery. We've highlighted the Heading Home Ramsey, which sit kind of in our planning area, but it also looks at other various points that housing stability manages. We were here last month to talk to you about the service delivery, and that was in the areas of eviction prevention we heard last month. So now we're here to just specifically talk about the Heading Home Ramsey, so it won't encompass all of what housing stability does. It'll specifically be in that area. Next slide. So as we look at our COCs and our structure, Minnesota has 10 COCs, and it's broken up into various areas. If you look at the slide, you'll notice that Ramsey County is probably the smallest COC area that makes up our position here in Ramsey County. But there's a lot of work that goes into that small area. We are one of 3 that are actually backed by county, or actually county within itself. So there's Hennepin, there's Ramsey, and then there's St. Louis County. They make up their own COCs, and they are the backbone agencies to those COCs, whereas others, the other 7 that make up Minnesota COCs, are backed by providers. So when we say the backbone agency, that means we're managing the inner workings of the COC, meaning funding, dollars, pass-through dollars. They're governed through the Housing Stability Department. One confusing thing is that as you look at the map, you will look to see that it appears that there's 11, but just keep in mind that up north, there's 2 that makes up 1. They're the same color up top. Those are 1 COCs. It's just there's a COC that sits in the middle of that area. So just wanted to make sure I was clear on that piece. Our Heading Home Ramsey Continuum of Care, we have a vision where we work together to create community where homelessness is rare, brief, and non-reoccurring, where we eliminate racial disparities and everyone is housed. Our mission, we want to prevent homelessness by delivering effective, people-centered, integrated responses that are racially equitable and driven by community voice, advocacy, and learning. We in Housing Stability are also adopting those same priorities because we want to align our work within Housing Stability to go along with our collaborative. And so those are some key pieces that we want to make sure that as we develop our priorities within our organization of the COC, that we align our work to do so as well. And we've asked others to do the same. That does not say that all of what we do in Housing Stability is specifically driven through the COC. As the Housing Stability Department is going to have their own priorities on things that we believe to be high-level things that we need to get done in this area. So will our partners will also have some things that they do outside of the COC. So we wanted to make sure that we kind of clarify that as we look at further into the slides. You'll understand why some of the funding and why folks are still being able to do some things that they still need to do as an agency. And as we pass the torch over to Jatu McCoy, one of our planners in Housing Stability, I've asked them to, in the interest of time, that we take it at a high level, but certainly we want to give some time at the end to ask specific questions around if there are specific questions you have, or if there are specific areas you want to dive a little deeper, we can have time for that in the end. So without that, without further ado, pass it over.
Thank you, Director Lattimore. Good morning, Chair Ortega, Commissioners, and County Manager O'Connor. My name is Jatu McCoy, a planning specialist with Ramsey County's Housing Stability Department. I serve as also Heading Home Ramsey's Communications and Engagement Lead. I would also like to mention I'm a former special education teacher, so many of how I deliver may be teacher-esque. So good morning. At this time, I'll go ahead and briefly discuss our governance and structure. So this is the structure, as you see on the screen, of our COC as a community-wide collaborative, and we pride ourselves on being community-wide as we strengthen our efforts collaboratively. We have 2 semi-annual all COC meetings that are open to all in the community to participate and vote. We also have a 25-member governing board, 10 of which are designated positions, and the rest of which are elected by the full COC. We have a 23-member steering committee, which half of whom are elected by the full COC and half of whom are appointed by the governing board as well. County COC participants include Workforce Solutions, CED, Mental Health, and Veterans Services. We have a standing systems performance and ranking committee as well, with delegated powers to rank projects in our collaborative applications and forward those recommendations to the governing board for final approval in accordance with county procurement policies. Finally, we have work groups, including our youth advisory board, to map and analyze our system, develop strategies, find small wins, and make the case for bigger changes. I'm a proud member of our family shelter work group who works diligently to advocate for youth and families as well as children. Just want to also provide an example as far as our work groups and the efforts that they put forth. Our project to create a single point of entry for emergency shelter for single adults started in work groups, and then over the course of a year became a set of recommendations that were vetted by our steering committee and approved by our governing board for funding and implementation. So again, small wins and making the case for bigger progress. Here on the screen as well, you'll see all of the organizations that are currently represented on our governing board and steering committee, which include current county representatives from county board, EGCI, Housing Stability, Mental Health, and Workforce Solutions. We also have representation from the City of St. Paul, City of Maplewood, and Metro HRA. We also have numerous key partners, including Catholic Charities, Interfaith Action, Lutheran Social Service of Minnesota, and Wilder Foundation. HUD has also prioritized partnership with healthcare providers, and a representative from mHealth Fairview recently joined our board. In addition to all of these providers and organizations that you see before you, we have additional people and organizations who actively participate in our work groups and youth advisory board, one of those organizations being United Healthcare. And so as we think about our community collaborative to end homelessness in Ramsey County, it is critical that Heading Home Ramsey is representative of the community we serve. So with that said, to help inform our 2023 Notice of Funding Opportunity Collaborative Application, NOFO Collaborative Application, we conducted a voluntary survey of our governing board, members of our steering committee, work groups, and planning staff, and we found the following. We have 20% of those from this survey who responded identifying as a person with a lived experience of homelessness. 20%. We had 39% identified as BIPOC, 23% identified as a member of the LGBTQIA community, and 19% identified as a person with a disability. This survey is just one way in which we can use data to measure and ensure that our continuum of care is person-centered and also responsive to community needs. And so with that, at this time, I will invite our COC coordinator to my left, Leanne Ahmed, to discuss responsibilities, programs, and strategic priorities. Thank you.
Thank you, Jatu. Good morning, Chair Ortega, County Manager O'Connor, and Commissioners. We'll try to keep this high level, as Director Lattimore suggested. So what are the responsibilities of Heading Home Ramsey? The federal government Department of HUD does require that each major community have a COC. And what that means is we serve as the collaborative applicant for the annual federal funding that becomes available through our RFP process, otherwise known as the NOFO. And so that is a significant amount of our staff's time to apply for that funding. And when we say collaborative, that means we utilize our ranking committee, and we identify through the ranking process which providers will be carried into our application, and then we receive notice of our funding based on that application. Another major function that we have is to operate the coordinated entry system, and this is really a single point of entry for housing, making sure that we have a community prioritization system to identify those who are most vulnerable, get the available housing first. And then we are responsible for the annual point-in-time count, which happens every January, as well as the housing inventory count, where we keep a count on all the affordable housing. And then finally, as a collaborative, we're responsible for designing and developing the community homeless response system in partnership with the providers.
Mr. Chair.
Very briefly, so we can keep moving
Excuse me.
forward. This is an example.
Excuse me.
Yeah.
Peter?
Can you, we have a lot of acronyms. I don't know, I didn't see what HSD stands for.
I'm sorry. Housing Stability Department is the lead agency
Okay.
that supports Heading Home Ramsey Collaborative.
Thank you.
So as I mentioned, one of our main responsibilities is to apply for these funds. It takes about 3 months out of every year to write what ends up being a 300-page narrative for grant funding, which is our most significant source of stable funding at this time. HUD supports permanent supportive housing, rapid rehousing, and other support services like outreach and coordinated entry. It does not support emergency shelter. And so in order to apply for those funds, we rely on providers to supply their HMIS data, their stories, and we rely on our evaluation of our system's performance measures. Some of the measures that we have to show that we're doing well on includes length of time homeless and successful placement into housing and no returns from housing back to homelessness. So you can see our score is trending up, and we will learn this February or March how we did with this current application.
Excuse me, Victoria.
Okay, I'm just wanting to make sure that I understand which funding source we're talking about. So this is strictly the federal funds, not the state funds or
Correct.
other
Yep.
potential
This is the main
options.
role of
Okay.
the COC.
Just trying to put it in context.
Yep.
Thank you.
Next slide. So, Commissioner Reinhardt, you were just asking about the other funds. So our collaborative is unique in that we do manage funds on behalf of the community for other funding sources. So the minimum required funding is from the HUD, federal government funding, but we also, through a partnership with the City of St. Paul, manage Emergency Solutions Grant. And we also manage the state's Minnesota Housing Finance Agency FHPAP funding, which we talked about a couple weeks ago in the prevention workshop. That includes the Homework Starts with Home funding. And then more recently, we haven't yet had a chance to bring this in front of you as the board. We're anticipating that we will in February. We applied for Department of Justice funds for a Familiar Faces initiative. And in collaboration with the City of St. Paul, there will be a joint powers agreement where the City of St. Paul will administer these Familiar Faces dollars, which is intended to serve 100 of the most frequent users of emergency services in downtown St. Paul and the surrounding area. Through our legislative session immediately following COVID, we received $6 million from the governor's office through the Department of OEO. That's the State Department of Office of Economic Opportunity. $6 million known as the Big $3, and that helped us to plug some of the gaps from the shelter funding.
Excuse me, Victoria.
Okay, so I am curious. I know that I think it was in the last time we talked, I was talking about the change in state funding, and so I don't know if that's the FHPAP or I don't think it was the ARPA funds, but where the state legislature changed the formula, and so that more of Greater Minnesota was included in the funding formula, which had a huge impact on Ramsey County because of the level of need, which it sounded like maybe hopefully they'll do some tweaking on that because the level of need should be commensurate with the amount of money that you are provided. And I know that, and Chair Martinson and I and others have also talked about the fact that this had a really big impact on Catholic Charities in particular, but others in Ramsey County as well, and that we have that as part of our legislative platform to go and try to work in partnership because the organizations that are providing the services, we partner with them in service providing, but we have to partner with them in legislative advocacy as well. Absolutely. And so again, I think that's a really critical thing that we're trying to draw awareness to, and to say we need to look at need and the extensive need that we have in the core city here.
I have Ryan.
Mr. Chair, Commissioner Reinhardt, just to clarify a couple of points along the way in the broader piece that I totally agree with. First, so this is not a funding formula at the state level that we're trying to get changed. It was that the state was allocating money at a moment of the surplus into capital builds around the need for emergency shelter around the state. And similar to a formula that sometimes makes decisions that we don't agree with, the state, through DHS, wanted to allocate a higher share of the money to areas that currently don't have emergency shelter and are not dealing with the immediate need than the areas that are. And so, it's not really a formula so much as a decision they made that shorted the areas in the metropolitan area with immediate need, which then led to the impact you had. And so I would just say when we're at the legislature, this is actually more about a point in time decision from the agency about choosing to invest in future prospective expanding shelter around Minnesota, which is a good thing, but at the expense of immediate needs today and for this coming winter as it goes. So the formulas, and the reason I say this is the new formulas related to housing passed last session are good formulas that take into account needs in a good way on the sales tax side, and we would not want to ask them to change the formulaic side.
So I guess a follow-up to that is, when I talked about MELSA earlier, we got more money, but the way it was potentially going to be allocated meant that we actually got less in Ramsey County. And so, and I said, they're working, we'll work on that and get it fixed. But so it sounded, I guess I'm confused because I thought it was existing funding because, and it wasn't just Catholic Charities, that's the one I'm most familiar with, but that they actually lost funding. So if it's additional funding, how could they lose funding?
Mr. Chair, Commissioner Reinhardt. So they are coming with a significant operating deficit according to Catholic Charities. This is about money above and beyond status quo from the past. We asked for $15 million a year for 5 years in Ramsey County through the COC's approach to investment to ensure that this community can handle what is now the highest level of homelessness nationwide since 2007, as of recently today. Wow. While shelter gets built around the state, because the state was investing all this money in capital. The state, in the end, settled on a position of, we will give you some of that money, but not every dime you're asking for, which led to reductions from the amounts that Catholic Charities and others in the continuum of care were asking for, which has left them with operating deficits. So it's not that they were cut, it's that they did not receive enough to make up for the idea that their model during the pandemic has changed and been impacted.
Well, all I know is that we're going to partner with them as we're trying to make sure that everyone, and including the funds that come through the state to Ramsey County and to the contracts that we have to make sure that we're working very well with our partners and whatever we need to do at the state, because they're partnering with us, we partner with them in order to get the funds to provide the services.
I have my Denvina.
Thank you, Mr. Chair. Would you go back to the previous slide showing the trend, the NOFO score trend? That went by really fast, so I was just trying to process and process this information. Can you share a little bit more about what's like impacting our trend here, where it's kind of like we're going in a good trend, but then we kind of level off here for this, and also how we can get a better score, because a better score leads to more funding.
Absolutely. Mr. Chair, Madam Zhang, Commissioner Zhang. So what we receive is an annual renewal demand, or ARD, which essentially is a variety of factors, including our county's population and poverty levels, much like a lot of the HUD funding that comes through CED is reflected based on population and poverty. Within that, that's sort of our baseline. And if we're able to show through our data, which is collected through a database called HMIS, Homeless Management Information System, as well as our narrative. So it's a lot of grant writing plus performance measure review. And our overall numbers from the PIT count and our housing inventory count. So it's like a little bit of all the pieces of data that say whether or not we made our baseline. And then if we do well with that and we're able to demonstrate that we're making some other proactive, progressive interventions. For example, this year we applied for domestic violence funding. And we applied for expansion of our current project. So there's like a pool of money, and we asked to go above that. So fingers crossed, we hope we are able to demonstrate through our grant writing as well as the measures that and other gaps in the community, so gaps analysis, that we will be able to go above that trend line and get additional money in. So anywhere the range is between like 6.8 million and I think 7.2 million is our baseline at this point, or our ARD.
Is there anything going on in the our continuum of care to like share why like we're trending in that way?
Trending upwards?
Yeah.
I would say that the development of Housing Stability Department and the restructure of Heading Home Ramsey has been significant, has made a significant impact on Heading Home Ramsey. And so it's just we have, frankly, more staff to address the issues. We have a large team. Right now I have a team of 7 individuals, and most of them are spending their time on Heading Home Ramsey.
Great, thank you.
Rena?
Mr. Chair and Commissioner Reinhardt, in response to the continuum of care coordination as we go into 2024 legislative session, advocating for Ramsey County, one of the things that I learned when meeting with Representative Pinto is that in regards to like policies, and maybe it didn't align to our vision, is that the priorities around continuum of cares was not a priority. And so we may need to look at a policy change in language in order to make the continuum of care a priority in allocations of dollars across the state. And so I know that's one of the things that we're going to be working towards going into 2024.
You know, I don't know where to interject this, but it was mentioned, I don't know if it was you, Ryan, that we've had a nationwide increase in homelessness and so forth. I was just reading, I'm trying to remember where I read it, just in the past week, that the expectation, because of a lot of factors, as you probably know better than I, in terms of housing, the market, and another increase next year of 12+% in homelessness nationwide. So I'm trying to, you know, you guys are doing a wonderful job. I'm not, but I mean, we're fighting uphill here if these issues become real, right?
Yes,
I just want to make sure that we're not just looking in the rear view mirror, that we're trying to get ahead of the curve with some, because no matter what we do, we need to plan to get ahead of the curve, whether it's legislative or whether, and rather than reacting to last year's problem. Because
Chair Ortega, it's a daunting task. I think that there's no one specific reason. There are multi-factors that is contributing to the growing rate that we see in homelessness. As we talked to this board last month, we looked at just the eviction rate of what is the work that we're doing just to keep people where they are so they won't contribute to those numbers going up. But there is competing interests around as we look at nationwide trends, we look at various things with some of the politics is going on when it comes to, undocumented families that are here, that's also driving resources. And we look at, housing rates and all the other stuff that goes into it. That just means we have to be more creative, and it really challenges us to what we have available to us. That's why it's such an effort to try to get as we look at those trends going up, that's why it's important for us to continue this work, because without it, we'll see trends go down and the problem gets even worse. And so that's why we have dedicated, and it was to this board's decision to say bring on Housing Stability Department is why we can see some of those trends moving forward now. And us really putting the resources where we believe it's going to be more impactful. But it does also mean that we have to have a bit of reality as well to see what can we do and what is the status quo and how we switch and be innovative into making some of those changes work to kind of produce some of those best results. But we are fighting an uphill battle, but no, that's why the work is so important.
just one last, my experience, it's Tuesday, maybe in the last 5 days, just last night, there was this lady that came up to me in the car. She was bleeding, and I saw a hospital tag on the thing, and I'm assuming she was homeless, and then I did get a police officer to help her. And then previous to that, a gentleman came up to me panhandling, and he had a cast on, walking the streets, and didn't have proper footwear. So my sense was, do we have folks that going in for medical care and then released, and they're just really don't have a place to go to?
Commissioner Ortega, we have various partners that we talk about those partners in the COC. All of them do specific work within Ramsey County to try to, mitigate some of those things from happening. Oftentimes, we're seeing right now, as we look at our winter warming space that we're managing, we oftentimes send transport over for those individuals who are being discharged from services, but who are being discharged to homelessness. So we send a van over there to pick those individuals up and bring them to warming spaces, as probably at different times of the morning, they're not able to get into some of our shelter beds and other vehicles that we have to work with them. And then, of course, we always try to keep our wraparound services involved when you talk about all those individuals to get those emergency services to those individuals. But we are seeing some of those cases.
No, I know you guys are doing a great job. I get feedback from folks in the community. It's just that it just seems to be, because downtown, West 7th, I mean, I run across it more frequently, I guess, is the issue. And I'm just curious as to, because my initial reaction this past week is it looks like they received medical services, then they're discharged and nowhere to go, right? And it seems like I'm seeing more of that. Versus people that are in camps actually have a place to live. These folks just seem to be more vulnerable in many ways. Well, thank you for your work.
Well,
Go ahead, Rita.
Mr. Chair, I would say yes. Homelessness is growing exceedingly.
Oh, yeah, it has
right,
been.
for many different reasons. That we see the, population growing and more visible and more present. From addiction to, can keep rent being unaffordable. There's just many, many different reasons why we see such a greater need now. Not just here in Ramsey County, but as we look over to Hennepin County, in the big encampment, and the thing is, like, even when you break up an encampment, where do they go if you don't have enough housing? If you don't have enough, shelters, if you don't have enough transitional housing, because the need is outweighing the availability right now. And so they just move from place to place, right? And for some, in Ramsey County, we could, with all the many partners that we have here in Ramsey County that is involved in the continuum of care through a coordinated effort, we're still falling short. It takes real dollars too.
Exactly.
To house people, which is, as we are seeing the rising need in care or lack of housing, which is one of the, I'm going to stray a little bit, which is one of the reasons why we're going to bring to the legislature this year to allow food stamps to be used for cooked food. Because if you don't have a house and a place to cook your food, at least you can go to a store and get a hot meal. And so this is where we are right now, and I think we have to respond in so many different ways as to the solutions to really see the dignity in every person, right? And provide those services.
Talking about the legislature, at the last Downtown Alliance meeting, I brought up the issue because a lot of the businesses and the building owners are saying, what is the city? They really point to the city in that case, and I came in and I said it's not a city problem. It's really a state issue, but I told them that they need to be allies with us. So, Rena, when you go up to the state capitol, it'd be good to touch base with Joe Spencer to get those business folks, because this should be on the top of the list for Securian. Should be on top of the list for all the building owners, that they need to help us at the legislature to get the resources we need. And that was just last week, because they have a different lens through which they look at this, and we need to get them on playing with us on our game plan, because this board has been saying for over 20 years, it's a state issue. It's not a county issue. We should be dealing this at a different level, because the homeless we're serving are not all Ramsey County residents.
Absolutely.
And the same goes for Hennepin. So anyway, keep in mind that we should push the Downtown Alliance to up their game with us at the legislature. Because they you know, they add to the influence to move our agenda forward.
I like that, Mr. Chair, because really it's all our problems.
Yeah.
And when the homeless is in downtown St. Paul, it impacts those businesses. So I do see a need for all of us to be in this together to really move in an agenda at the legislature that is putting those dollars in. And we all need all those thinkers at the table.
Yeah, that's right.
Yeah.
Thank you,
Go ahead,
Chair.
continue. Oh, did you
Just a
have
quick,
something?
well, just because we've seen this number and it might be in the presentation, but I completely agree with everything you're saying, Mr. Chair. We've seen a number where people identifying as Ramsey County residents who are homeless versus from other parts of the state. It's about, is it 50? I don't know, what are the numbers? I know it's fluid, but well, can you just give those to us so that we can, in our remarks, using those, because I'm using them, and I want to make sure I'm using the right numbers.
Yes. Chair Ortega and Commissioner McGuire, if you look on slide 21,
Thank you.
you will see that the last county of last known residents for people entering into shelter, 34% identify that they are affiliated with Ramsey County. Always challenging because these are individuals without housing or residency. And then if we calculate for the unknown, so people who are unsure or we didn't capture the data through the various providers, it could be, at the most conservative, we can say 50% of the individuals are identifying as last known residents of Ramsey County, which means we're sheltering a great proportion of the state. Yeah.
This is just a chart we need to carry with us at the
Yeah.
legislature.
Yeah.
For sure, and with the governor's office.
All right.
Thank you. I'm sorry, Mr. Chair, it was further on in the presentation.
No
I just
problem.
thought we were
I think
talking about it, so.
If it's okay, I think we can skip slide 15, where we just lift up some of our key initiatives, which you'll hear us talk about as we move forward. And then we're going to move into our key performance indicators that is driving our work. So what is some of the data that we know that's driving our strategic planning as well as the legislative platform, right? So when we talk about coordinated entry, we know that there's a gap between 15,000 and 18,000 affordable units for people at or below 30% AMI. We also know that for coordinated entry, which is designed to assess those who are most vulnerable, or i.e. chronically homeless, that on average, we assess youth, families, and single adults across our community, across all cities of Ramsey County, 67 households per month. So that's 67 new households get assessed per month that meet the chronic homeless definition. This isn't even just folks hitting housing court for the first time for eviction. This is a chronically homeless definition. Of that, 2,039 households are on our waiting list as of today, with 636 average vacancies posted by our housing providers. So you can see there's clearly a gap where we now have over 600 days of wait time between individuals being assessed, placed onto our wait list, and then connected to the available housing. Now, we're doing a lot.
Excuse me.
I recently
Excuse me.
repositioned. Yes, sorry.
Mike?
This is great, and I appreciate this for 2023. I think what would also be helpful for me as one of the policymakers is also just seeing the trends too about over time going into the future. Thank you.
Thank you. So some other data that informs our work. As I mentioned, we are responsible for the annual point-in-time count, and this is every major COC across the country has to lead a point-in-time count on the same day in January. They pick the coldest day, and we see that numbers across the country are going up, and that is not obviously any different from what we're experiencing. So we saw an 185% increase in the number of homelessness in our community. That means sheltered and unsheltered between the time period of 2018 and 2023. The 2023 point in time count found our largest number ever of unsheltered individuals at 368. And then we also know that with the advent of the warming centers, which again is a priority that really grew and developed out of Heading Home Ramsey, that we were seeing an average of 300 people last year, and this year already, I think we're seeing an average of 420 individuals who are unsheltered and using our warming centers every night. Racial disparities are pervasive. If you are an individual who experiences...
Mike, go ahead. I'm going to interrupt you a lot, it looks like.
Yeah, going back to the last slide about the point-in-time count, are we partnering with our schools to capture that data too?
Yeah, Chair Ortega, Commissioner Zhang, yes, we have started to partner with our schools. Last year, we made a couple steps forward, and this year, our data evaluation analyst, Alyssa Kyle in the back, is working very proactively with the schools. We're hoping to host some pizza and some gatherings at the schools to bring the parents out to share their information and share their data. HUD does not recognize them technically as HUD homeless, meaning they're not unsheltered individuals if they are not using an emergency shelter or unsheltered. The term that's used in the community is doubled up or couch hopping. So many, many, many of our homeless families aren't represented here because they are not considered HUD homeless. However, the schools do collect data, and that's called the McKinney-Vento Act data. And they are also going to help us participate in the point-in-time count so that we can more accurately reflect and bring along this PIT data that's required by HUD, our community's data on families that are doubled up. And what we know is that it's going to be staggering in the hundreds just based on what we've heard from our school social workers at the Suburban Collaborative as well as St. Paul Public Schools Project REACH.
That's great.
Yeah.
I just wanted to ask about that too, because, you know, as someone who represents one of the youngest districts, what was like very puzzling to many of like our electeds during the redistricting was the realization that, wow, the east side has grown so much, but we were like scratching our heads. We're like, where did this number come from? Because we didn't even get so many developments, you know, so it was just very surprising. So like, to me, like that tells me that, you know, there are definitely, it's undercounted, as well as, you know, doubling up that's happening a lot in our communities.
Absolutely. Okay. So as I mentioned, the disparities, it's pervasive in the homeless community. So if you identify as Latino or Latina, you are 2.2 times more likely to experience homelessness than your peer group that are white. And multiple races represent 2.9. If you are Black, African American, you are 7.4 times more likely to experience homelessness. In Native American, American Indian population, if you identify that community, you are 14 times more likely to experience homelessness. So what do we know about our shelters? Ramsey County has just 9.5% of the statewide population, but as of January of 2022, our housing inventory count, we show that we had 24% of the state's emergency shelter beds. And this means that we have the greatest density of emergency shelter in the metro area relative to our population. So what about Hennepin County? Hennepin County, for example, has more shelter beds, but they obviously have a much larger population.
Mr. Chair, if I can just add too, because one of the most common refrains we hear in the conversations at the legislature as we're trying to advocate for statewide solutions to homelessness is that Ramsey County needs to do more and that you aren't doing enough yet. And in the moments of heightened, you know, challenge, that's a critique that comes out and we all feel a certain way about it. But I think this is a really important slide just to point out that, so if we aren't doing enough and we need to do more, I agree, but there are 86 other counties then and a state that also need to be doing that as well, because relative to everyone else, Ramsey County is doing the most. And I do think that's very important to point out in those conversations, because I don't think this always gets understood.
Yeah.
And then as I mentioned on slide 21.
I'll let her do this one. I can
Okay.
respond to this one.
Go ahead.
Okay. Just restating what I mentioned earlier on slide 21 is county of last known residency. Just 34% of all of our emergency shelter entries had a last known residence in Ramsey County. If you add in the unknown, that means, again, still half of the people that we bring into our shelters identify with Ramsey County or less.
Rena?
Yeah, Mr. Chair, I do want to say that Ramsey County is doing a lot, you know, but also I think this is why, you know, even though we didn't understand why the legislature decided to give rural Minnesota money, they need to. They need to have the infrastructure in their community, in their towns. People really want to be close to their families. They want to be in their town. And the stigma of homelessness is different from it is in the city than it is from those rural communities. But they need to build an infrastructure there in those rural towns across Minnesota. And, you know, they need the capacity, because we are being overburdened by at least, I think it was 32% of folks coming in from rural Minnesota into Ramsey County to get the services, 32% to get the services here in the city. And and when we become burdened, you know, with housing or taking care of individuals from rural Minnesota, it takes away from all the other things that we also need to be doing here for Ramsey County residents. And so, really, this is a call for rural Minnesota to stand up and do their part also, like we are to do, and then for people to recognize the great work that we are doing with the little resources that we're getting from the state to make up from everyone else from across the counties, across the state.
You know, I totally agree with you that we need to build the capacity statewide. And so funding rural Minnesota is something we should support. To be honest with you, my pet peeve is with the metro area, because besides Ramsey and Hennepin, we need the other 5 counties
That's right.
to stand up and do their
agree.
fair share.
Yeah.
Yes.
Okay, go ahead.
Thank you. I will pass it on to David Zaffron, Planning Specialist, Housing Stability Department, and A. Lee, Planner with Heading Home Ramsey.
Thank you, Leanne. Thank you, Mr. Chair, Commissioners, County Manager O'Connor. Leanne just gave my introduction. Planning Specialist and her team, David Zaffron. I have the last major section here. This is a snapshot of our current one-year funding cycle for the Heading Home Ramsey funds that are within our sphere of influence as the lead agency, alongside the other Housing Stability Department funding sources as a service provider, as a county. And so Leanne mentioned earlier the 4 main program funding sources that we administer on behalf of the COC, the HUD COC program, the federal ESG grant, FHPAP, which is the state's prevention program, and Homework Starts with Home, which is sort of a subset of FHPAP. They total about $11.7 million in the current year. I want to note that these funding cycles don't all line up. So this is sort of a snapshot of the current funding year from July 1 to next June 30. The FHPAP funding phase that we're currently in is actually 9 months, from this October 1st that we just passed through next June. And Homework Starts with Home is currently in a 2-year cycle, so this shows half of that money. As the lead agency, about $335,000 of that stays in the department as administrative funds to pay for contract administration and other indirect costs. The rest of that goes to providers of those services who are part of the COC. As we noted previously, and as you all know, this past legislative session, we advocated for funding from the state to again go through the COC as it did the year before. Legislators instead made the choice to make grants directly to providers. That totaled $11.4 million in one-time funds that can be spent over the next 2 years, over the full biennium. So DHS allowed for the flexibility of 2-year contracts and flexibility within those 2 years. Many of these providers are seeking to use these funds over that full 2 years, but not all of them are. Some expect to use all of these funds within 1 year. So it's not all apples to apples in terms of how all these providers intend to use them and at what pace. And just to stress again, HSD does not administer these funds on behalf of the COC the way that we did the year before with the $6 million in ARPA funds that came through the state. However, we did as a county receive funding for 2 specific projects as a provider, the winter warming centers and the single point of entry project, and that's reflected on the next slide.
Victoria?
I would like to go back to the other slide. Yeah. I would like to see kind of historical data in the same format. Obviously, not expecting you to have it here this moment, but I think it would be helpful to see where we have put our money as well. The money that we're getting from the state and who we contract with. So if I could get some history on that, that would be great.
Mr. Chair,
To
Commissioners.
the whole board, I should say, not just me.
We've got 8 minutes, so I'll give you 30 seconds.
Yeah, just a quick one. Remind me, and we can do this offline too. Are any of these ARPA dollars, are they've already been spent and these are just now more additional dollars, right?
Mr. Chair, Commissioner McGuire, yes, the ARPA funds, the $6 million in ARPA funds from the year before have all been expended correctly. Correct.
Okay.
I think there are still emergency rental assistance dollars that are being spent by the department. That got covered largely last month when we were talking about eviction prevention.
Okay, thank you.
Commissioner, I want to make sure I'm clear. That is state allocated money. We did not make these allocations.
Right.
This is a state appropriation from the legislature directly down to those
Okay,
entities.
state funds directly.
Yes.
Not through us.
Correct.
Correct.
Not to the
Okay, great.
COC.
Thank you for that
Correct.
clarification. Thank you.
Mr. Chair, Commissioners, just to clarify that further, the reason that I included that in here, since we're not administering those dollars, is because we advocated so heavily for those dollars at the state, and it really was the result of our efforts at the Capitol that led to that additional funding. So this next slide is a visualization of all of those funds in the last 2 slides that we just covered, including those direct provider grants from OEO. And again, this is annualized for comparison purposes. So this is sort of a 1-year snapshot. And again, the funding cycles for these programs don't all line up, so this is a bit of an approximation, but I think it's a reasonable one for our current funding year. Those direct grants from the state are represented in the middle of those dark blue pie slices. And what's showing is half of that money because it was 2 years worth of money, and this is a 1-year snapshot. Again, not everybody's spending that way, but this is the way that looks in terms of 1 year worth of that money in the Housing Stability Department budget on the right, and the rest of those grants as part of the Heading Home Ramsey funds on the left. This is not the totality of funds that all of our partners in Heading Home Ramsey receive, obviously. There are other sources that go directly to them from public and private sources. But again, this is sort of what's within our sphere of influence, as I've said, as the lead agency. So on the next slide, it shows proportionally where those Heading Home Ramsey dollars go by project type. Projects can include multiple categories of activity, so there's a little bit of double counting between the pie slices, but it shows the sort of broad apportionment between them. Roughly 1/3 goes to permanent supportive housing and rapid rehousing, 1/3 to emergency shelter and day shelter, and 1/3 to prevention, outreach, and supportive services. This represents a pretty significant temporary increase in the prevention dollars by the state, in particular, the FHPAP program. There's sort of a big boost for a couple of years, and then that returns to historical levels in future budget years. So we'll have to see if that is what the legislature chooses to do. And then this emergency shelter money is heavily dependent on that additional funding from the state. As Leanne noted, HUD, the federal government, does not fund emergency shelter. That's really where most of our permanent supportive housing money comes from.
Mr. Chair.
Okay, before that, I want to give some time to Trist. I've been ignoring her.
Thank you.
Oh, no.
Thanks. Thank you, Mr. Chair. I just wanted to point out the last three slides to me tell a really important story. This is the reason that we keep telling the legislature and others that we have to prioritize working through the COC. You know, right now we have the continuum of care and our partners have come in voluntarily. We don't have, you know, they don't have to report to us. They're partnering with us because we see the need as a community and we need to address homelessness as a community, and it only works if we have all the information and we can get a good assessment. So, you know, as commissioners, you're wanting the data and the information, but we only know it if our partners report it to us, and it's hard to demonstrate a whole picture if funding doesn't run through the continuum of care. And so I think that you know, all these different funding streams, all the ways that we do this work is so complicated, and it's even exasperated then when the legislature, like, they decided to directly fund our partners and not include us as the continuum of care. It's really hard then for our housing support to kind of keep an eye on a track and where the needs are, where their perceived needs, where they actually are, and where there's gaps in services if we don't have a good sense of the picture. And so I just wanted to highlight that as we've got a lot of information, we've seen this information repeatedly over and over, but it really lays out how complicated this is if we don't prioritize working through the continuum of care.
Mine?
Thank you. I just wanted to go back to that slide. Just, can you explain the difference between the permanent supportive housing, transitional housing, and also rapid rehousing?
Mr. Chair, Commissioners, I may have to defer to our COC coordinator, Leanne, on this question, but I think largely it's a question of how long that rental support lasts for. Transitional housing is very short term. I think it's up to 30 days. Is that correct?
Yes, Mr. Chair, Commissioner Zhang, permanent supportive housing is really the resource for our most vulnerable individuals who are chronically homeless who need a lifetime subsidy and also those services, right? And that's why it has the service component to it. Whereas rapid rehousing, you can be chronically homeless and need services, but oftentimes it's up to the community how to use it. It's up to a 24-month rental assistance. Because we have a shortage of housing, we're actually kind of using the two. So one of our coordinated entry approaches as we try to make fixes to our system is to look at rapid rehousing as like a step up to permanent supportive housing. But other examples of permanent supportive housing, that there is HUD funding, and then there is housing support, which is funded by the state of Minnesota, and then public housing authorities also have permanent housing. So when you think of vouchers that an individual kind of qualifies for based on income and disability for a lifetime with services.
Great. Thank you.
So very quickly, this slide shows, again, proportionally where funding goes by population. And I would just note that youth can include transitional aged youth or young adults up to 24 years old. And for the right slide, for the point in time count, those young adults would be counted as adult-only households in our point-in-time count. So that explains a little bit of why the two look a little different. And broadly speaking, I think our funding lines up with our population pretty well. And then finally, this is where the Housing Stability Department funding goes by category. 41% funds department staff. That's both the planning team as well as the service delivery team who carry out so much work that's aligned with these same COC goals, including shelter entry for families, coordinated entry, and a whole lot more. About 40% goes to contracts with providers for emergency shelter and day shelter, 12% to prevention and rental assistance, and 7% to the warming center program.
Rita?
I have a question. What is a child-only household? A child-only. What's a child-only household?
Mr. Chair, Commissioners, these are the terms that HUD uses strictly for the point-in-time count. So adult and child households would be families, adult-only households would be single adults, and a child-only household would be
I'm
youth-only,
sorry, could you repeat
single
that
youth.
again?
So adult and child households would be families, adult-only households would be what we usually say are single adults, and then a child-only household would be single children or unaccompanied youth.
Is that 18 to 20? What's the age? Is it 18 or 21?
Under 18?
Is it under 21 or under 18?
I believe that'd be under 18, correct?
Under 18.
I'm
So
not
Because-
sure the answer to
kids
that
under
question.
18
Yeah.
that have their own household.
Yeah. I'm getting a thumbs up from my colleague, Alyssa. So it'd be under 18 are the unaccompanied youth, and young adults, 18 to 24, would count as the adult-only households or single adults.
Okay.
Thank you so much. Keith, you want to wrap it up for us, please?
Yes, Commissioner Ortega, fellow commissioners, county manager. We wanted to come and kind of give you this oversight, so thank you for having us. I know it's a long day, specifically at the end of the year, but these are important milestones that we're faced with, and there is important work ahead. So we wanted to just be able to give you and level set where we are currently. I think we talked a little bit about the legislative already through Commissioner Moran, who spoke a little bit briefly on, and I think, obviously with our COC chair, Chair Martinson, who sits, at home with us. I'm glad that she's here today. So thank you for having us. We do have some things that we've jotted down. There are some asks from various commissioners around the table. We'll plan to get those to you as soon as we can possibly get them back to you. And try to, get that information to you, hopefully in a short amount of time.
And Mr. Chair, I think the last thing I would just add on top of that, thanks to the entire team, Director Lattimore, for this presentation today, and more importantly, the work you're doing to bring together so many community partners around one of the most challenging bodies of work we're doing. It was important to do a baseline setting of what the role is the COC plays relative to Ramsey County and where we ended last session, because you all get asked questions on it. And so today wasn't the goal to answer every single issue under the sun, but it was hopefully helpful in that broader baseline and gives you a document you can consult when being asked questions this legislative session.
I just want to say that you guys do fantastic work. This is a tough one. And it's on everybody's radar, believe it or not. I've been at people's home and it comes up. I've been at meetings of the Downtown Alliance. It's an issue, and I think we just got to keep galvanizing an effort here to really do the type of investment long-term that we need to do to address this issue. As I tell folks, to make it manageable, St. Paul, we want to stay ahead of the curve. We don't want to be San Francisco, for example. I mean, some of those issues become totally out of reach sometimes, but we can still handle this, and we just got to get ahead of it. Thank you for your work. Happy holidays.
Thank you.
Thank you.
Paul Regional Water Services launched an ambitious 10-year plan to replace all lead pipes in its service area at no cost to property owners. While lead is not present in water leaving the treatment plant, it can get into drinking water from lead service lines entering a house. St. Paul Regional Water Services treats its water to minimize leaching. This process, called corrosion control, creates a protective scale on the inside of the pipe between the water and the lead. While corrosion control is highly effective,